Hello, my name is John. I'm the area coordinator for Pasco County, and we're here today to talk about Medicare Part C Advantage plans. I'm a volunteer with the Department of Elder Affairs, and their vision statement is for all Floridians to live well and age well. What that really means is to keep seniors in their home as long as possible with the right services. And part of the Department of Elder Affairs is the SHINE program. And our program is we're here to provide free, unbiased health insurance counseling through our network of volunteers, empowering Florida seniors to make informed decisions, really to make you an educated consumer. And SHINE is a free program offered by the Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specifically trained volunteers can assist you with the Medicare, Medicaid, and health insurance questions by providing one on one counseling and information either via phone, Zoom, or in person. Our services are free, we're unbiased, and we're confidential. Shine is not affiliated with, nor do we endorse any insurance company or product. And there are 11 AAAs in the state of Florida. You can find your numbers by going to floridashine.org and clicking on your county. But what does Shine do? We help with original Medicare Part A and Part B. We can help with Medicare Advantage plans, commonly called Part C, which we're going to talk about today. Medicare prescription drug coverage, either standalone or an Advantage plan. Medicare supplement insurance, or commonly called Medigaps. We can assist people with getting extra help for prescription drugs, which is administered through Social Security. We can help people with applying for Medicare savings programs to help with their Part B premiums and other costs from original Medicare. And this is administered through the Department of Children and Families. And again, it's income and asset based. We can help with long-term care planning, Medicare complaints and appeals, and lastly, Medicare fraud and abuse. So let's get started. So what are the Advantage plans? And to understand that, you need to understand the paths to Medicare. There are two. And the one is original Medicare with combinations of optional coverages to help bridge the cost of original Medicare Part A and Part B, and standalone drug plans. The other side of the equation is an Advantage plan. And Advantage plans are very commonly like employer health insurance. An original Medicare is Part A, which is hospital coverage. There may be a premium if you have less than the 40 quarters, but it does have deductibles and copays. And Part B covers medical, all things outside of a hospital environment. And you have to pay premiums, deductibles, and copays. And then there's the optional coverages. And the optional coverages are Medicaps. They're sold through private insurance companies. They help bridge the original Medicare costs, and there are premiums and deductibles. And then the standalone Part D drug plans, which is again sold through private insurance companies. There are premiums, deductibles, and coinsurance, and the costs vary by plan. And then there's the other path, which is the Advantage plans. And what are Advantage plans? They're an alternative to original Medicare. They actually replace the coverage. All your expenses are covered through the Advantage plan. They are part of the Medicare program. All plans that are listed on Medicare.gov are approved and vetted by Medicare. They have a lot of different names. Medicare Part C, MA for Medicare Advantage with prescription drugs, and Medicare health plans. And they are sold and issued by private insurance companies. And the difference is you receive all your medical services through the plan. And you may have to use the plan's network and doctors. We'll talk about that in a little bit. The cost sharing is different than original Medicare. Typically, Advantage plans are constructed to have premiums and copays for the different services, and most include prescription drug coverage. You really will need to have prescription drug coverage unless you're receiving your drugs through a different retirement plan or the VA. And one of the things too is that what makes Advantage plans attractive is they all have vision, hearing, and dental. And you must still pay your Medicare Part B premium unless you have plans that are paying part or all of your Part B premium for you, or if you're receiving state assistance for those who qualify. You may have to pay additional plan premiums. You may have additional out-of-pocket costs, which are going to differ from Medicare. And these copays vary plan to plan. And costs will be higher if you're using an out-of-network provider. And what is eligibility and enrollment? And who can join an Advantage plan? Well, you must be enrolled in Medicare Part A and Part B. You must live in the plan service area. And this is very important because Advantage plans are based upon zip codes and counties. You can enroll if you have end-stage renal disease, but you must enroll. Enrollment is not automatic in Advantage plans. And when can you enroll? You can only enroll during official Medicare enrollment periods. And when are they? The most common is the initial enrollment period, which is 7 months around your birth month, beginning 3 months prior to your birth month and ending 3 months after. After that, there will be penalties and timeframes when you can enroll for Medicare. And then every year there's an open enrollment period. Starts October 15th, ends in December 7th, and the coverage begins in January the following year. And during this time, you can switch from original Medicare and Advantage plans to other Advantage plans or change your drug plans. It's very important because every year the companies all change a little bit of what their structure is and what the costs are. And then the special enrollment periods. And the most common of these is working age, where people are getting medical benefits through their employer past their 65th birthday, so they do not need to enroll in Part B until they're going to retire. If you move to a new address, you're going to have to find out whether your plan is accepted there and maybe or probably have to change your plan. And if you lose your coverage involuntarily, meaning usually a layoff, you have a special enrollment period. And if you're enrolled in certain financial assistance programs or you want to upgrade to a 5-star plan. And then there's the general enrollment period. And this is for when people did not enroll in Medicare when they were first eligible and do not qualify for a special enrollment period. And we tell people do not get themselves in this position because you have to wait till the next January 1st and until March 31st, you can enroll in original Medicare Part A and Part B. If no Advantage plan is chosen, original Medicare coverage begins the month following after enrolling. But you can enroll in Advantage plan or add a standalone drug plan anytime from after April 1st to June 30th. So you can add during the 6 months Advantage plans or Part D plan. And then every year they call it the Medicare Advantage open enrollment period. And really what it is, it's for somebody who wants to make a change to the plan they took selected during open enrollment. It can be used only once and for any reason. And this runs again from January 1st to March 31st. And again, the effective date will be the first day of the following month. And the options are you can switch Advantage plans, switch back to original Medicare, switch to a different Advantage plan, and you may also add a drug plan. Now, the key thing is here, this is where people make a mistake during open enrollment. And when they select a plan, and it's really not advantageous, usually meaning their doctor doesn't take the plan they selected. And then there's trial right. And trial right is if you, during your first time of eligibility for Medicare, you get an Advantage plan and you're unhappy with it, you can change back to original Medicare Part A and Part B and get a Medigap and a Part D, still having what they call a guaranteed issue right, which means you have to be accepted in the plan with, and they do not consider any pre-existing conditions. And you can also pick up a Part D during this time frame. And what type of plans are there? There's the HMO, Health Maintenance Organization. The co-payments are set by the plan, but you must use doctors and hospitals that belong to the plan's network. You may be required to pay in full for the care outside the plan's network, but they do have nationwide emergency and urgent care coverage. You must choose a primary physician. Usually you will need a referral to see a specialist. And a key thing, doctors can join or leave the plan's network at any time. And again, most include drug coverage. Then there's variation, the HMO point of service. Very similar in structure. Again, the co-payments and co-insurance are set by the plan. You have to use the plan's network. The key difference with this is you can be referred outside the network and the services will be covered. This is able to be done in the case of a physician not being available in your plan, that they have to refer you outside your plan. It's a variation of the original HMO. And then there's the PPO, the Preferred Provider Organization. Now, the difference here is you can see any doctor or provider who accepts Medicare and or the PPO plan. You do not need a referral to see a specialist or an out-of-network provider, and you will usually pay more for out-of-network care. Could be up to 100%, but each plan sets their own out-of-network costs, just like in-network, and the co-payments are set by the plan. They may include prescription drug coverage. It's recommended you choose one with it. It's free. And the difference is PPOs can be local or regional. Local plans are several counties surrounding your zip code, whereas a regional plan covers the whole state of Florida. And then there's a thing called a private fee for service. It's no longer offered right now in the state of Florida, but what it is, it's a different type of plan. The plan negotiates with the physician's office or physician group for the costs. So it may include prescription drug coverage, but in this case, if it's not included, you are able to purchase a standalone Part D plan. And then there is the special needs plan. And this is plans that are focused care for different types of debilitating conditions. The doctors in these plans are geared to these conditions, and it's all about a care plan for severe medical conditions. They all do include prescription drug coverage, but SNPs are only available to those who have certain chronic or debilitating conditions, such as COPD, end-stage renal disease, and severe diabetes, to name a few. And if you are eligible for Medicare and Medicaid, you can enroll in a dual SNP plan. And if you're in a certain institution, you can enroll. And then there is the Medicare Savings Accounts. It's made up of two parts. Part one is the Medicare Advantage Plan with a high deductible. And what that means is you pay a set amount of money out of pocket before the plan kicks in. And then after that, it has a structure where they give you back money, and it works just like a health savings account when people work, but it's very uncommon because people really are not looking to lay out large sums of money. But you also need to fill out special tax forms every year when you have this. And as I said, the plans are very rare. And then there's the distribution of Advantage Plan enrollment. And most people are in HMOs because they're more cost effective for people. But then the PPOs basically make up the difference. And again, there's more freedom in this to go to specialists and to travel. And what the key considerations are, you have to live in the planned service area. And if you travel outside the planned service area, depending on what type of plan you have, you may lose your coverage after being out of the area for 90 days. Some of the plans say you can be out of the area for up to a year. But the next key thing is, are your current doctors accept the plan? This may be the most important thing when deciding on a choice for an Advantage plan. What I tell people when they narrow down their search and before selecting it, call their doctor's office, ask for the business manager, and ask what Advantage plans they take. Because most people do not want to change their doctors. The other key thing, are your prescriptions covered in the plan's formulary? And will you need to choose a primary care doctor? Definitely yes for an HMO, not necessary for a PPO. Will you need a referral to see a specialist? Definitely in an HMO, not in a PPO. And are you limited to certain providers? Yes, because of the way the networks are structured. And what are your rights and protections? You have to have all the rights and protections of original Medicare. And if a plan leaves Medicare for any reason, you can join another Medicare Advantage plan or return to original Medicare. And the key things are, you have to be able to get the needed healthcare services. You're supposed to receive easy to understand information, to have your medical information kept private, which is HIPAA. You need to have a choice of healthcare providers, and you need to have access to these healthcare providers. There's always a complaint that I cannot get appointments fast enough for certain specialists. That's something Medicare can't control, but that's a choice you need to be able to have these doctors. They need to have the providers in their networks. Know how your doctors get paid? Very simply, they get paid by the plan. Is there a fair and efficient and timely appeals process and grievance process? Yes. Every Advantage Plan's homepage has a place with the paperwork to start an appeal or a grievance. And a key thing is you have to have the coverage and payment information before a service, such as if you're going for a CT scan, you need to know the copay that you're going to pay before that service is provided. And again, you have to be able to have your personal private health insurance, health information kept private. And the marketing guidelines are a slightly gray area, but all Medicare plans have to adhere to the guidelines of Medicare. Their marketing materials are approved by Medicare. They must disclose the plan's information at time of enrollment and annually. What that means is when you enroll, you get what's called the summary of benefits, which explains all your coverages and your cost in detail. And then every year in September, you will get what they call an annual notice of change, which will highlight and list what the changes are for the following year. People are not supposed to solicit door to door, make cold calls, or send spam email, loiter in common areas, or call after a sales event. This is probably the most violated part of the marketing guidelines because people are out there getting public information lists and then finding out people turning 65. So that is why people do get calls. They're not supposed to market any other products such as annuities, life insurance, or anything else they sell. These are insurance agents, and I guarantee they're selling more than one type of insurance. And organizations may call individuals who gave them permission for a plan or a sales agent to contact them. This is very common in your search. If you call the plan and ask for an information, they're going to have a sales agent contact you. They can offer nominal gifts for potential enrollees. This is very common. You'll see them on TV during open enrollment. They can contact members who are eligible for extra help with Medicare's approval, and they can call existing members to conduct business related to enrollment in the plan. And they can call former members after disenrollment to do basically a quality improvement survey. And the greatest place to start looking is Medicare.gov. You go in. If you do not have an account and you do have a Medicare account, create an account, because the information you will see is what you're currently getting through your Medicare, which is if you're in an Advantage plan, you'll see your Advantage plan that you have. And during open enrollment, this is very crucial because it shows you your plan and then the plans for the following year to complain. If you're not on Medicare, you're new to Medicare, you put in your zip code, you select what you're looking for, put in your drugs, and then click on the next screen. You select some pharmacies, and then you will see all the plans in your zip code, starting with the cheapest, which will always be an HMO. And there are tons of filters on the website here to narrow down your search for what you're looking for. And if you really have any questions, call Shine. Call our 727-217-8111 number, or go to floridashine.org. And here is where you can turn around and get the information and get help. Thank you, and have a nice day.